So this is an interesting case. This is actually my wife. And I want to show you here that she has an angular artery that's in its typical position on her left side. And I'm going to just show you, and I'm going to measure it, and it's right here. Okay, so here's the bone. And it's basically halfway between the skin and the bone. And, typical position, 3.5, 4 millimeters deep. And there's about 3.5 millimeters or 4 millimeters deep to that. So that's an easy shot. But on the opposite side of her face, you're going to see something entirely different. You're going to see that she actually has two angular arteries, and one of them is along the periosteum. So there's the typical one that's in the mid portion between the skin and the periosteum, but over here is a deep one. Okay. So this is someone you have to be extremely careful with these deep injections. And you wouldn't know that she has two or she has one that is deep if you didn't have your ultrasound. So now I'm just going to measure the depth of this one. And you will see that there's probably about 1 millimeter, less than a millimeter between that artery and the periosteum. So it's quite a difficult injection in this patient. You might consider a more superficial injection with a cannula for safety purposes in this patient.